Big question people have is how do I bridge that health insurance gap from wherever I'm going to retire to age 65?
We talked in segment B about, taking a large distribution or, having a big expense. Retiring without health insurance is can be an easy way to run into those unexpected expenses.
Right.
So there was a survey out here, the Retirement Confidence Survey from the Employee Benefit Research Institute, said 70% of Americans retire before they are eligible for Medicare.
There you go. So why are we having this conversation today? Why are we talking about this episode? I mean, people are doing it, right? I mean, but let's talk about some options when it comes to health insurance. I mean, the first one would be, okay, another employer-sponsored plan. So if you're married and your spouse is still working, that's one way to jump on where you're still covered.
Right. If there's been a plan to retire early or one spouse to retire early, that's kind of the easiest way to go is if one spouse is still working, jump on their plan.
Right. And the other thing too is number two, you can jump on COBRA, right? But that only goes for 18 months. I mean, so sometimes what people would do is they would plan their retirement and say, okay, I'm going to retire maybe 18 months prior to age 65. That's one way to bridge, right? I mean, it's an option. I'm not saying it's the best option, but it's an option.
Yeah, and if they're forced into retirement early or kind of the unexpected, it is an option that you have available to you to kind of at least bridge a gap for a while, let you figure other options out.
Yep. Another way is you take a look at a private plan. I mean, so you would take a look at the ACA and look at your options there. I mean, there are some things there. I mean, you got to find a plan that makes sense for you, but where you could potentially get a premium tax credit. Again, that I'm not going to get too deep into that, but it really comes down to your income that you're bringing in, which because again, that's a subsidy in terms of to help you with your insurance premiums.
Right, and generally the private plans can be expensive. The premium tax credit, if you're willing and able to really monitor your income or have a low income need, that can be an option to you. But it is income based, and higher income levels, it can get expensive pretty quick.
Right. I mean, and then there's HSAs out there as well too. But I think the big one, I mean, if don't just spring this on people. If you're looking at retiring early, I mean, plan ahead for future healthcare costs. Period. I mean, you're going to need healthcare. Because again, I already said this, I don't move an inch unless we have some form of coverage. Because again, even if for clients that have the financial means where they can retire, this is the one thing they're looking at. They are looking at, how do I bridge that gap before I get to Medicare? So again, Tom, it's just about having that plan when it comes to not just health insurance, but everything overall.
Yeah, retiring early, you're looking at when you're eligible for Social Security. Does it make sense to claim Social Security early? Do we need to defer? Do we have the assets to bridge to defer that? If there's a pension out there, again, are we claiming early? Are we waiting? That's all part of the plan. And looking at potentially 20, 25, 30 years in an early retirement situation, that's a lot of planning involved.